Good afternoon. Thank you. The post-lunch session is always the most difficult session, and I don't know throughout this year why I've been asked only to speak in post-lunch sessions. So please, please, please cooperate with me, because there's a lot of stuff that we are all going to talk about here that's very relevant even for people who want to stay healthy. Okay? It's not me only who's going to talk about the healthcare opportunities here. Being a consultant, obviously, I've done a lot of research. I've got, some fancy slides to show you. But I have two entrepreneurs with me. One very senior entrepreneur, Deepak Ghaisas, and I'd like to invite him to stage to be here. Deepak has been chairman and he's chief mentor of Genkowal Group. We were talking, before lunch on what Deepak is doing, and I'm fascinated. I'm not going to steal his thunder, but Deepak is doing some really cutting-edge stuff in stem cell banking, and he'll share that with you, along with what his view as a very senior entrepreneur and businessman, and having been on boards of companies like USV, Shoppers Stop, Camlin, how he sees the view of the world. And since everybody is doing gold rush chasing today on healthcare, what's really happening out there? The other panelist I have with me is Dr. Grewal. And Dr. Grewal comes in all the way from the UK. So he's a very different definition of the entrepreneur, and there are many, many more that we are seeing, especially in areas like health and education. So Dr. Grewal is trying to set up a venture in India, and he's going through the grind right now. And we'd like him to share his view and his perspective on how he sees India. And he's been part of a very, very developed, evolved health system, which is the NHS. And I had requested Dr. Grewal to share his views on how the NHS system has also worked, and are there any things we can take away from them? Good, bad, whatever it is, but they run some of the biggest chains, practices, primary care, GP practices in the world. Dr. Grewal, welcome to the panel. Yeah, so I'd request Dr. Grewal if you could start off, with your session, and then followed by Deepak. Thank you.
Thank you very much. I had a very nice lunch today. My mum, I'm Indian by origin, but I've never been to India until a month ago. And I thought my mum made fantastic dal until I came here, so I had a great lunch. So how do I change the slides? Fantastic. Okay, thanks Amit for passing that on to me. Okay, so I was asked to speak about healthcare opportunities in India from a macro perspective, but also from an entrepreneur's perspective. So I'm going to talk about that part of the presentation. And then I'm also going to talk about my involvement with the UKTI, who have helped me as an entrepreneur trying to break into India, and what kind of journey I've been on. And then finally, as Amit mentioned, I'm going to talk about the NHS and changes in the UK, and if there's any, talk about opportunities around that for both entrepreneurs in the UK, but also entrepreneurs in India or wherever in the world. Okay, so I wanted to put some things in context. So, as I said, I've been on a journey, and up until very recently, I wasn't really aware of the economic transformation in India and how that's evolved over the years. So, some of the learnings that I've had over the last year or so in terms of trying to choose whether India is the right market for me to enter with my product. And usually you start off about looking around. How well is the country doing economically? And so we had to go on a quick history lesson. And so I realised that sort of post-independence, 50 years ago, industry was very much regulated, a lot of licenses, a lot of industries restricted to the public sector. And then post liberalisation, 1991, there was an increase in trade, sort of a big increase in domestic entrepreneurship and promotion of that. And that sort of got me thinking and thought this is sort of a place I want to try to enter and do business in. So again, looking at growth in India, this graph here is sort of quite typical. You can see the growth in India, the GDP growth, well in advance of other advanced countries in the world. And the sort of the trajectory has been quite typical. I was quite interested to find that all economies had a dip, not post 2008, but the dip in India was less, and he came out of it quicker, which was quite encouraging. A slight dip over the last year or so. I don't know why that is really. So potentially because of infrastructure problems, investment, lack of demand from OECD countries, things like that. And then going forward, growth looks fantastic, averaging at least 5% per annum over the next 30 years or so, 40 years. And in the next 5 years, 6%. So this is an exciting place for me to come and do business in. So how's this happening? What's causing all this growth? So there's obviously been changes in demographics. So over the next 10 years, we anticipate about 13% increase in population. The dependency ratio is decreased. And then there's obviously increased buying power, and the middle class sort of group of the consumers is increasing. Again, that has my attention. And I'm going to talk a little bit more about that later. And then finally, as a scientist, as a clinician, obviously the number of science graduates, PhDs, doctors is increasing, and that's going to feed into growth into the healthcare industry. And again, I think that's something around about 23% compound annual growth rate from 2010 to 2020. So it looks very exciting. And then if you look at the farm industry as part of that, again, you see a massive increase over the next 10 years in terms of what's that worth. And all that's been driven also by government stimulus, hopefully anyway. So the other thing I was interested in was if I came to India with my product, who's going to buy it? Who should I be targeting? Who's my consumer segment? And again, a lot of research. I spent a week at the Jain Institute about a month ago with the professors there, and they were sort of sitting down with me and teaching me about consumers in India. And this is a schematic they produced, which is produced by McKinsey originally. And it's quite interesting to see that the middle class consumer portion of total consumers is increasing, and that's where I'm going to try and market my product. And it seemed like a sensible thing to do. And again, sort of in parallel to that, I looked at imports, and imports have steadily increased, more than steadily increased, amazingly increased. So there's a high chance that my healthcare product would, be imported and used by Indian consumers. And also, the other interesting thing on this schematic was, okay, I know who my consumer is, but what are they spending there as an entrepreneur? I want to know what they're spending their money on. And it was interesting and very reassuring to see that healthcare as a percentage of expenditure has gradually increased from 1995 and is looking to increase to about 13% of individual consumption by 2025. So that is really exciting. So I'm in the right area. And also on their personal products and services is also a related segment. And again, that's showing healthy growth. And then adjacent to that, when you drill down further, I wanted to see which healthcare areas consumers are spending their money on. And so this was quite interesting to see. So you notice on here the anti-infective segments, vitamins and the GI in 2001 is around about 56% or 50% of that, 56. But that's actually decreased in 2011, 2012 to about 34%. And there's an increase in parallel to that in more sort of longer term conditions like COPD, diabetes. So there's been a change, which is quite interesting. And most of interesting for me is the increase in the dermatology, gynecological and pain analgesic sector, and that's a sector I'm trying to enter into. So that was very encouraging. So it all looks quite promising. Oops, that should have been a bit on the other side. I'm not sure where, as a clinician, the products that we give out can either be prescription only, pharmacy only, or OTC products. And I was quite interested to see where the growth was amongst those three types of products. Again, the interesting thing was that the OTC segment of medicines is increasing markedly. And if you're an entrepreneur and you're looking to sort of develop a product, I would recommend going for an OTC product at this stage. For a number of reasons, you just have a much bigger customer base, consumer base, patient base, and these figures show that. So on balance, I think India is a good. I think India is a good place to do business. Certainly, the rise and buying power of the middle classes is very attractive for me. And then from a manufacturing perspective, I think India has the most FDA-approved manufacturing sites outside the USA. Again, so that's reassuring. At the moment, my dermatological products manufactured in the UK, and there's having spoken to physicians and clinicians, they value that. But in the longer term, if I brought it to India, then I'm pretty confident that I can maintain the quality, etc. There's always going to be challenges, and I think one of the big challenges for me is around supply chain. If I'm bringing a product into India, how I'm going to get that to a patient, and that's something I'm grappling with at the moment. And again, price. Everyone's, every time I speak to somebody, they say it's the wrong price. It's the wrong price. It has to decrease. So I'm getting used to that, and we're trying to accommodate everybody. So this is just going back one slide. Just go back. Oops. So I'm going to talk about the UK TI now, my involvement with them. So this is the product we're trying to introduce into the Indian market. It's a product that treats dry, itchy, flaky scalp. It's a condition that affects millions of patients globally, irrespective of climate and race. And it's marketed in the UK, and we're speaking to dermatologists here and doctors, clinicians, and just trying to discuss with them how best to do that. And we're at the very early stages of that. And our main issue is how we get that product into the market and deal with the supply chain and deal with detailing the product. And sort of been on a journey with the UK TI up to date, and we'll continue to do so. I think continue to be on that journey for quite a while. So that's a pretty obvious statement from my research. It's a market you just can't ignore. Okay, so Amit also asked me to just talk briefly about healthcare opportunities in the UK, and Amit mentioned the NHS, and it's quite an interesting time at the moment in the UK. We're going through a big change. Up until, over the last 10 years or so, we've had our healthcare NHS structure has been structured, delivery's been structured through PCTs and strategic healthcare authorities, and they've had essentially, we found that that structure just didn't work. PCTs were somewhat inefficient and laden with debt over a number of years. And so there was a movement in the UK government, led by the Conservative government, who wanted to really sort of look at that and change the way healthcare is delivered in the UK. So essentially, what they decided to do is change the total philosophy on healthcare delivery in the UK. Sort of formally from April next year, they wanted to change the way healthcare is delivered and put the patient and the doctor at the centre of that. So now, instead of having 152 odd health authorities or PCTs delivering healthcare, that's all going to be abolished, and we're going to have what we call clinical commissioning groups that are GP-led, doctor-led. And these GPs are responsible for delivering commissioning healthcare services. So I live in Leeds, which is a reasonably large town by UK standards of about 800,000 population, and that's going to be split into 3 CCGs, and each of those CCGs is going to be responsible for delivery of healthcare. So things like...
I'm sorry, but can we just pace it up slightly?
Yeah, it's last slide. So essentially what this means in terms of from a healthcare opportunity perspective and an entrepreneurial perspective is that in the UK we're finding lots of organisations approaching us, GP practices, around can we help you deliver some of these services, be that diabetes clinics, dermatology clinics, dialysis clinics, etc. And also from a marketing perspective and strategic perspective, we have the likes of KPMG, Deloitte, whoever, McKinsey coming to us and speaking to us about helping us deliver this from a marketing, strategic and leadership perspective. So that's something for you guys to take away and think about. And I think that's it. Thank you very much.
Thank you, Dr. Grewal. And I think the reason why I asked Dr. Grewal to mention NHS is all this happened in the last few decades. And, you know, when we are working with a lot of entrepreneurs in India as KPMG, I think it's important to take note of how health systems across the world are transforming, because India is no different. And many of the things that we are seeing now in India were taking place in some of the more developed health systems a few decades ago. With that, I'd like to invite Deepak to share his thoughts.
Hi. I don't have any presentation. I'll just speak. And next 15 minutes, I think you're going to keep the time, right? Great. So just tell me after 12, 13 minutes and I'll wind it up. Very quickly, this is based on what I've been doing. For the last 3 years, I've been in healthcare. Before that, 20 years in IT industry. Before that, in food industry. And basically, I'm a chartered accountant. So that's the background. Now, when I started looking at the next phase in my life, what I should do as an entrepreneur, I realized that healthcare is something which is going to be the next trillion-dollar business in this world. Because most of us who have made enough money in life at a young age are going to spend that money entirely on keeping us well in well-being in next 20 years. Because we want to be healthy. And then when you look at the entire healthcare system, I realized that the world is looking at this healthcare system very suspiciously, because what is currently happening is disease management and not healthcare. But most of us go to the doctors only for managing our diseases and not remaining healthy, because health is not a subject that is taught anywhere in the medical education, anywhere in the world. And then realize that right from diagnostics to the disease management, we are far behind than what we desire and what we deserve. And that's where the world started looking at the whole scenario in last 2 decades and realized that we need to find some solutions. And when the world has started looking at finding some solutions, obviously there are business opportunities that one can look for. And that's where I started looking more closely, realized that the pharma industry, for example, I'm on the board of a pharma company. We convert every disease into chronic so that you become my patient throughout your life. And I'm happy with that. Because the diabetes, for example, doesn't get cured. You keep on popping my pills throughout your life once you start eating them. Same thing with the hypertension. The things like Alzheimer's and Parkinson's are never treated with the current system of medicine. You don't have more molecules coming in, because the number of patents which are getting filed in the United States even are reducing day by day. So there's no next blockbuster which is going to come in pharma industry or in the drug market. The portfolios of most of the pharma companies are going down, and life expectancy is growing. So you don't want to live till age of 90 or 100 or maybe more with your knees broken, with the diabetes, you can't eat sweet, your hypertension, you can't eat salty, you can't walk and climb, and if happens to get a thing like Alzheimer's, probably a vegetable. So how you live your life between 70 and 90 is very important for all of us, and that's where the world has started looking at it, and that's where the world is going to spend a lot of money onto quality of life. And when you look at the quality of life, people realize that the things that you can really look at is to remain healthy or remain a good physic without diseases or with managed diseases. But idea is to change your lifestyle in such a way that you get predictive diagnostics, whereby you are warned before it happens to you, and accordingly you can change your lifestyle. And that's where the people started looking at various solutions. The same thing happened to the things like what I talked about, diabetes and Alzheimer's, Parkinson's, and hypertension and kidney failures and so on and so forth. These are all the problems that actually reduces the quality of your life. And that's where people started looking at them. We tried one heart to be taken from one, or kidney to be taken and implanted somewhere else. That technology has worked somehow, but is not working so well. And then in last 2 decades, people realized that something may be possible with the help of biotechnology. And once you saw that as a scientific community, we realized that a lot of research is possible. And then they slowly came down to what is called as stem cells. And I'm not getting into the details of stem cells. But the stem cell, when I looked at the stem cell or biotechnology as a business, and maybe also the dermatology business, what we look at. But take dermatology, for example, since Dr. Grewal is from that field. The simple thing like if you have got the fibroblast cells in your skin which get reduced as you grow older, and that's what gives you wrinkles, you have to take some fibroblast cells out while you are young, preserve them, multiply them, and give them back, and that becomes the solution for the anti-aging. And if I look at anti-aging market, it sounds very simple, but it's not so simple. It has a process. But if you look at the anti-aging market, it is like $67 billion currently in the world. So $67 billion market, definitely as an entrepreneur, you want to be there by taking a patented technology, using them, utilizing them. Same thing happens to things like reversing the diabetes or getting your knee replacement avoided totally, and getting your stem cells, your own stem cells into your body, which can repair or regenerate your bones or repair your brains and get relieved from various quality problems of your life. If that is the world going to look like future, 2 decades down the line, I think there are 4 segments of biotechnology business I can look as an entrepreneur. One is very clearly to create that ecosystem, and that's where my company StemMade is currently. And when I say ecosystem, it starts with banking of the young stem cells. So what I do is that this is a patented technology whereby we take the stem cells from the tooth, which is either what we call as molar tooth or wisdom tooth, or deciduous tooth, which is milk teeth. So between age of 6 to 12, when our kids lose their tooth, milk teeth, there are 12 normally in the mouth. You pluck one of them, break that tooth, take the pulp out, where the technology by which we can distinguish the mesenchymal stem cells out of them and preserve them under cryopreservation, which can be preserved for next 70, 80 years. And use them whenever the patient or the customer would require that. Now taking that ecosystem, this is what is called ecosystem. Why it is required today? Because 10 years down the line, there will be therapies which are available, because lots of billions and trillions of dollars are getting invested in R&D, and the various stages at which all this R&D is going on, is definitely going to give a delivery system by which there will be what we call as ATMP, which is Advanced Therapeutic Medical Product. So these products will be delivered in the healthcare delivery system, which is hospitals. And if that is going to be so, the ecosystem for that should be ready now, so that our children who are 8 to 10 year old today, 20 years down the line or 40 years down the line, will be able to take advantage of all this technology, which will come then. Because your older stem cells will not be useful. When at the age of 80 or 70, if you get a problem and you require stem cells at that time, if somebody plucks that from your bone marrow, probably they are not going to be useful for you. And that's why catching them young is important, and that's why we are helping that as a business model. So that is one. Second model is obviously the CROs, or clinical research organizations, and all these ATMPs which are going to come are actually going to come only after the clinical trials happen. So there's a huge scope for biotechnology related CROs or clinical research organizations, and it's similar to what in IT, since I was in IT for 20 years probably, it is similar to what we used to have the BPOs or KPOs, and those can run very well and work very well as a business model. The third one is actually doing R&D, whereby we actually create ATMPs after the clinical trials. So you create a therapeutic model whereby you brand, patent your own medicine, injectable medicines, whereby some medium can be used to have your own stem cells. And believe me, this is not going to be the mass production. This is going to be autologous medicine, which is a personalized medicine for you. There'll be a common, it is like a soup, that you go in the restaurant and ask for a soup, there is a common stock available. So those stocks will be made by probably pharma industries, and then you have your own stem cells into it and get injected. That's the way the things would look like, and therefore creating ATMPs, there will be investment, but once you get that through, I think there'll be great success and great royalty that you'll get. So that is the third business segment. And the fourth business segment clearly is the healthcare delivery side, which is all these products will be actually delivered in a particular way. So what they say, maybe 20 years down the line, your body will never be cut for any operation. Right from cardiac bypass to your knee operation to your neuro operation. All these things will be managed by injecting the biotechnology material through your body, and that biotechnology material is supposed to go and repair through these ATMP, R&D, and so on. And if this is the situation, then I think one of those four segments you need to be there. Depending on where you are, what knowledge you have got, what patents you can create or license them from outside India. But as I see what we were in 1990s for information technology, the way in which we are poised, I think India is poised the same way for biotechnology now. And maybe in future nanotechnology. And probably all these three technologies will get together to create another business model. But if you look at that, then clearly this is the era where India is again poised for the biotechnology spur as a business model. The only difference between IT and biotechnology I see is in IT, we always looked at United States and Western world as a market. While in biotechnology, I think the technology is going to get developed in Western world, but the market will be available in India because 1.2 billion people, and even if the costs are initially going to be higher, statistics we have seen in the earlier slides, you have got at least 12 or 15 million families with number of people who can afford. For example, if I'm talking about the stem cell preservation from the tooth, it will cost you around 1,000 rupees per month. And that's not a big deal. I think most of us spend that money. Even middle class person can spend that money every day, every month, and save that money and spend it for their kids. I'm finding the customers now where initially we were targeting the young parents whereby we can catch them for business. But now we also realize there are grandparents who want to gift this as a great gift for their next generation or to the grandsons and daughters as a gift so that they can preserve their stem cells, own stem cells, and maybe use them if they require in future. So the way in which it is a B2C marketing, we have to use the doctors to create that opinion. But once that awareness is there, either through social media or through the actual face-to-face or person-to-person marketing, then we have a great opportunity to either of these four segments once you get in there. So my belief is that this is biotechnology or the healthcare, including predictive diagnostics where you use the biomarkers, and the technologies are getting every day probably, they're getting tested, and another few years I think those all will be there. So once you have them, I think marketing them in India, creating that market is going to be a very, very interesting proposition for any entrepreneur who wants to start it today. But start it today so that you are there in the market early. Create your own brand equity, create your own processes, ensure that you follow all the legal requirements which are there in any country for that matter. And I'm not going to be only in India, I'm going to be in Asia, in Singapore, and Middle East. So if that is going to be there, then building a future scenario in next 2 minutes, that what will it look like? So probably you can create a stem cell factory, whereby, or any cell factory, I would say not even stem cell factory, it's a cell factory. Like you take fibroblast cells preserved, at an older age, you started seeing wrinkles on your face. You go to the doctor, tell him that I need to get my own fibroblast cells injected. I take 5,000 fibroblast cells which are preserved at your young age, bring them to the lab, use technology by which I multiply them to 100,000 cells. There are special injections getting created now to inject them back into your skin. And the moment those fibroblast cells are there back into your skin, your probably skin start looking again much younger. And these are much better technologies or therapies than the current therapies which are using chemicals which are toxic chemicals. So you create a cell factory whereby you preserve different types of cells of your customer, and whenever that customer requires them back, you take a part of it, multiply it, that is called passaging, you passage them and you send it back to the customer as an injectable. So that is a medical product that you will create. Not only that, going forward, probably you can once have the cell factory, one day probably 20 years down the line, 30 years down the line, you can create the organ factory. And whereby using those stem cells, using the multiple types of cells, you can actually create a patient's kidney in the lab and ship that kidney to the doctor who can implant that his own kidney. We're talking about the clones and all, but this is much better usage of stem cells. So you can create actually your own liver, you can create your own kidney. So what I will have one day, hopefully, that I will have the organ factory whereby I can create organs of the customers with help of their own stem cells preserved earlier and help them to have a better life. I'm sure with your good wishes, I think I can flourish again with the same kind of business. Thank you.
Thank you, Deepak. That was truly fascinating. And I think it gives a good segue into what I'd like to talk about, because we have a big problem in India. Can you put on my presentation?
Can we have Amit's presentation, please?
Okay, before I start, I was at a conference day before, and a very senior orthopedic surgeon was speaking. And, the example or the incident he mentioned, I have not been able to forget. So there was this young guy in North India on a train, and he fell off, and both his legs got amputated. So the people around, they actually picked him up and brought him to the hospital. And, when he woke up, he saw that his limbs were being used as pillows. So, ladies and gentlemen, I think the journey is long. The journey is very, very long for us. Let me show you why I think so. In the 1960s, if you look at where we were, vis-a-vis Thailand, South Korea, Brazil, we were exactly where they were. We're still not very far away. Brazil has moved from 117 to 15 in infant mortality, whereas we are at 49, the world average is 38. Thailand has moved from 81 to 11. We are at 49. And South Korea has moved from 59 to 7. Similar things on life expectancy. And to add to it, I think when you look at the overall numbers, we'll have more than 100 million diabetics and cardiac patients. More than 40% of people in rural areas will have cancer incidences. And I think we are not going to meet our Millennium Development Goals. However, the journey has begun. Less than a decade ago, we had only 5% covered by insurance. At least in urban areas, we have more than 25%. We have more than 500,000 beds that have been added in the last 10 years. May it have been by the private sector, and this is why I think all of y'all are here, because y'all have a great deal to contribute in how we build out healthcare in India. More than $2 billion over the last few years of private capital has come in as growth equity in healthcare, which is good news for all of y'all, because when we walk around the investment community, everybody is looking at how they can invest in healthcare opportunities, whether they're entrepreneurial, startup, mature, turnaround, whatever it is. But people are talking about healthcare. I don't know if you all are aware, but we have the largest telemedicine network in the world. We can talk about innovation and technology and computers and iPads and the Kaiser Permanente of the US, which is stage 7 in EHR, but we have the largest telemedicine network in the world. And to top it all, and which is why Dr. Grewal's point and what he mentioned about NHS was very, very relevant for this audience, the government is mulling a universal health coverage platform, which means that they will have an interplay of private players across various aspects of delivery come in and work, and the government may play a role, and they are deciding between it, whether they play a role of payer, which is when they do not interfere in the operations and the clinical processes, and they pay for healthcare and they cover people for healthcare, or they play the role of the provider. and we think that it's going to go towards the former. It may take time, but then what you all do in this room will help the government in clarifying that role over a period of time. What are we faced with? If you look at both of these slides, the left square is around high-income countries like US, UK, Canada, Spain, Saudi Arabia, and the right square is around low and middle-income countries, which is Brazil, Chile, Mexico, India, China, Turkey, and South Africa. We will have 58 million people who will die out of chronic conditions, and a large part of it will come from India. If you look at what's happening, and this is the 50% cutoff is between rural and urban. Look at all the chronic diseases. Hypertension, diabetes, heart disease, cancer tumors, 50% is in the rural areas. Which is why when you all go and build out your businesses, and it's not that, interestingly, if you see, urban also has something called urban poor. We no longer have a situation where we can say that the poor live in villages and the rich live in cities. We have a huge population of people who are still not privileged, who are living in cities. Which is why when you all build out businesses, I think, do keep this framework in mind. Cost, quality, and access. What will you build for the patients will help you deliver more affordable healthcare to them. How will you deliver quality outcomes? I think we have a big problem out there. And more than anything else, how will we provide better access? In the rural areas in India, many of the people have to walk more than 5 kilometers to get to the closest primary care center, and multiples of that to get to the closest district hospital. I pulled out some examples from across the world to address this cost, quality, access point. And I found one very interesting company called Medicol Home in Mexico, which now they've tied up with a cell phone service provider, and 1 million households subscribe to them. They'll be close to $1 billion over a period of time, but what they've done is actually transformed, because Mexico is very similar in terms of its fabric and income as India was, but they've created a channel where they actually incentivize patients to call in before they walk into the clinic. So if you've called a doctor and the doctor has not been able to treat you or diagnose you, and then you go to the clinic, you actually get a discount. That has increased the adoption. I think we are trying it. I know that Apollo is trying to do it with a service provider in India. I know many others are trying mobile health. But whoever is out there in this room trying to build mHealth, outreach programs, think about how you will increase adoption. And the second point, which I think to keep in mind on mHealth and mobile adoption is, think about urban as well. Don't only think about rural. It's not just about increasing access. I think it's also about increasing adoption. The other part, I think, is cost. And I think we have more than enough examples in India where we've broken the cost barrier. People from across the world, in fact, NHS keeps sending teams to India to figure out how we are conducting heart surgeries in $1,000, whereas their cost is more than 20 times our cost. We've got enough and more examples. And I think for a country like India, all of us will have to think how we are going to deliver something at very, very, very low cost and a scalable model. I think one of the questions which investors continue to ask, I think two questions. One is, at a unit level, do you make money? And B, if you do, is it scalable? And if you don't look at how you'll keep driving down cost while maintaining quality and outcomes, I think that's going to be a story which you'll have to put out for your own growth. And third is quality. And I think when we look at opportunities that are happening in India today, 2 or 3 big opportunities are coming up. And people have different views on them. But one huge opportunity is around home care. There are way too many people walking into hospitals who don't need to walk into hospitals. And the cost of going and staying in a hospital is way, way more than what it could be by treating the patient at home. And we are working with a fair number of companies who are thinking about remote monitoring, home care technologies, and things which you can do out of the home for which you don't need to enter into a hospital. So where is the opportunity? The list can go on, but for the benefit of the entrepreneurs out here, based on the research KPMG has been doing, based on at least people I've been working with, I just listed out 7 or 8 opportunities, and all of them are huge opportunities. They are huge because they are underpenetrated. Family medicine and clinics. The value chain in India today is just not existent. There are, as we speak, there are more than a dozen such clinics, specialty centers, GP centers coming up across the country, and they are filling a need gap. They are filling the gap where all of us are walking into hospitals, doing self-medication, overspending on tests, which we do not need to do if we have someone who gives us unbiased advice. Second I mentioned was home care. Third is diagnostics and clinical testing and screening. Both sides. If you look at the whole diagnostic landscape, today we have 120,000 labs. The organized market has just about 8 to 10,000. Of that, only 250 to 300 labs are accredited by NABL. Huge opportunity to organize, create models, consolidate. Screening. Government has announced and they are launching screening programs for cervical cancer, COPD, diabetes, blood pressure, because that's the way they're going to control inflow into hospitals. Dialysis. Vikram, who's going to join us in the next panel, and he'll talk about the dialysis story. Huge underpenetration. Single digits of the population today have access to dialysis centers. Reasons: not enough dialysis clinics, not enough nephrologists. Technology-enabled patient engagement. And we saw an example in the morning where someone was trying to do anemia testing. There are loads of gadgets that are coming up. I think there is huge opportunity in both areas to do testing, to have patient interaction, to put some stuff in patients' houses, either from a home care or monitoring perspective. Low-cost medical technology. While there are companies in India we are working with who are trying to do MRIs, CTs, PET scans at fractions of the cost, the rest of the world is looking to India to do it. There are companies in the US today who are innovating for India. There are companies in China who are innovating for India. This is a huge area that is going to open up, because today 70% of medical decisions are being taken with the help of diagnosis. It was not so earlier, which means that people will rely more and more on diagnosis tests, whether it's radiology or pathology, to take medical decisions. Health education. I think we can go on and on about it, because this is a huge gap in the market as far as which is concerned. And healthcare in tier 2, 3 cities. 60 to 70% of the health infrastructure is all in the 6 metros. There's literally absent or nil infrastructure of high quality, which all of us would be comfortable taking ourselves and our families to in tier 2, tier 3 cities. And I think there are models we are seeing in the market, may it be cost effective or costly models, but I think there is a market out there which some of you all could look at and evaluate. And the list goes on. I'll just go to some examples from across the world, and I just wanted to leave this as food for thought with you all. But the story is same everywhere. People are all talking about how they can use technology for better engagement, which is something like DrawMD, where 2 surgeons are doing consultations using the iPad. They're trying to capture all conditions. They have iPad as something they walk around with. You have Telemes in Europe, where there's a telemedicine, teleradiology that they're trying to do in Belgium. You have MediSherpa in Singapore, which is like a travel directory, because Singapore has a lot of health tourism that happens. And then you have in India, you have Dr. Saab Hai or JanaCare or MDhill, which are all patient interaction platforms, e-commerce, mobile phone related apps. To just give you an example, there are more than 90,000 apps today on phones, on mobile, for healthcare across the world. That's where the world is moving to. So there's a huge opportunity again on thinking through how you can use the phone and increase adoption through cell phone apps and mobile health. So what's out there for you? I think there's a huge market out there, and it's grossly underserved across all the segments. There is a need for disruptive models that address cost, quality, and access. There is a true need from the patient. I think if you build it around what the patient needs, and world over people are talking about patient-centric care, do keep that in mind. What does the patient need? And the world is watching what we do. So the journey is long, but we have begun. Thank you.
Thanks, Amit. Any questions? Quick questions, couple of them. Anyone? Anyone has any questions? Here.
Do we have enough doctors to do all these things?
So I'll give you a contrarian answer. Yes. But we have to think through what a doctor is supposed to do and what all could be done by people around the doctor ecosystem. And if you have a minute, I would like Dr. Grewal to talk about the nurse practitioner model in the NHS.
Yes, certainly. what we find in the UK is that, well, there's a couple of things. Telemedicine's very young in the UK. It's not really taken off yet, but it is starting to. But certainly when you go to a GP practice in the UK now, you're not always guaranteed to see a GP or a doctor. Quite often you can see a pharmacist who might be able to prescribe certain medications. You might be able to see a nurse who will do your blood pressure, your blood. If you're diabetic, often nurses will run the diabetic clinic, following a standard algorithm or formula for how to treat patients, etc. And so it's not always going to be, healthcare is not always going to be delivered by a doctor. And the typical time length, if you booked an appointment to see a GP in the UK, the slots are 10-minute slots only. And that's how we sort of try to deliver healthcare in the UK at this moment.
You know, one of the primary care clinics I saw in Singapore saw more than 12 to 1300 patients a week and high quality healthcare consultation. I think we've got to think about, you know, while we look at shortage of doctors, how we build more efficiency in the model as well.
Anybody else? We'll take one more quick question, please. Here.
My question is to Mr. Ghaisas. I wanted, sir, when you started this speech, you talked about prevention. You talked about changing of lifestyle when you detect some disease. So, and that the whole medical fraternity is talking about disease, but not about health per se. So, what kind of opportunities, or what is your thoughts on that side? How to educate people more on changing lifestyle and that.
I think the techniques are coming up now using the biotechnology again. Example quickly I can give you is the technology which has developed certain biomarkers where you take your saliva and apply those biomarkers, whereby you can predict at age of 20 or 25 what is the chance or probability that you will get a cardiac issue or a diabetic issue or a nephrology issue at age of 50 or 60. Okay. Now, every year actually you go through the medical test of that kind, diagnostics, which I call as a predictive diagnostics, and not what currently we do. I mean, today we do a stress test, and still you don't know whether the next moment you will get a cardiac arrest or not, right? Because it only tells you that so far you didn't go through any problem. So these are predictive diagnostics, whereby you know the probability, and every year if you change your lifestyle, the probability will go on reducing, so that you have a healthy life and don't start worrying about it when you actually suffer with it. Okay, and that's where I made a change. The healthcare, that is what is called healthcare, and what the current system is disease management and not healthcare. Yeah.
I think we'll just need to cut short the question answers here. I apologize for that, but Mr. Deepak Ghaisas and Mr. Ganesh Natarajan are going to be available at the Scale Up Lounge for the Gurukul session. Please don't lose that opportunity. And thank you so much, all three of you. We generally clap.